to Medica Nova Wellness Studio. I'm Dr. Angelika Maria Koch with the educational videos about optimal health and the most innovative and holistic approach to your well-being. In this month's video, let's take a look at how you can manage and heal bulimia with natural and effective therapeutic tools. Eating disorders are a real problem, especially among girls and women. But how can you tell if you or somebody you know is suffering from the effects of bulimia? And why do these types of eating disorders take hold in the first place? That's what I like to explore in this video. Binging on junk food and then purging it out affects your metabolism, your sleep pattern, if you're female, your fertility, hormone imbalances, definitely the digestive system, and your mental capabilities. But actually most of the stress is caused by battling bulimia nervosa in the first place, and that impacts all areas of one's life. So let's dive deep here and let's explore a more natural and lasting healing protocol. Enjoy this video. To stay updated with my ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and families, and don't forget to click that bell as it notifies you every time I upload a new video. And thank you so much for your thumbs ups and your likes. Lastly, have a look at my website, medicanova.net, at the online academy, where you will find comprehensive certified home study online courses, usually from 8 weeks to 16 weeks, about the topics in homeopathy for the whole family, integrated mental health, health coaching, quantum healing, and so much more. And Medica Nova has just expanded its coaching department. We are now national board certified, and we offer a transformative and inspiring 3-month smoking cessation program. So if you would like to know more about it, contact me at health@medicanova.net. So what is bulimia nervosa? Bulimia is considered a serious eating disorder that revolves around binging and purging, meaning eating large amounts of foods at once, followed by attempting to get rid of the calories that are consumed. Bulimia is considered a life-threatening disorder that affects millions of people, especially women, and is actually more common than anorexia nervosa. Now, the thing that makes bulimia nervosa unique from other eating disorders is the behavior of regular purging, no matter the cause. So the body takes on this automatic behavior. The emphasis is always on eliminating extra calories and attempting to stall weight gain or achieve the weight loss, but unfortunately in very unhealthy ways. So you get the idea that bulimia has to do with body image, how you are seen. You maybe heard about the Diagnostic and Statistical Manual of Mental Disorders. It's basically sort of the Bible of mental disorders. It's called DSM-5. And they characterized a person with bulimia who must have repeated episodes of binge eating, followed by excessive or inappropriate measures taken to avoid weight gain. And this should happen for at least once a week for a period of 3 months. And the sufferer should be over-concerned about his or her body weight, shape, and physical appearance. I think if somebody has really chronic bulimia, it happens more than once a week. So what are the symptoms? Of course, consuming very large amounts of food, the binge, so to say, followed then by the compensation behavior of purging, of vomiting. There's usually an intense feeling and chronic stress, being out of control when the binge eating happens. Maybe guilt feelings involved. The self-esteem overall is very dependent on the body weight and the image. But most people think actually those who struggle with distorted eating patterns are actually thin, and that's not true. It can really happen with men and women of all shapes and sizes who experience eating disorders. Bulimia can develop for many different reasons and is usually a combination of environmental and genetic factors. Who is more at risk? I talked about girls and women, adolescents, young adults, but also being involved in some type of sport like belly dancers, gymnasts, figure skaters, models, of course, right? Anyone who is associated maybe with female athlete triad, but also having a history in the family, maybe who struggled with bulimia, anyone who diets constantly, is focusing on one's weight gain and loss and preoccupation with being thin. A history of depression, anxiety, maybe mental disorders. They also say in teenagers who have experienced some psychotic episodes around the age of 13. Why that? Because the hormones are kicking in. And the sense of vanity and how you appear to the world is very important during that time. So how does bulimia nervosa actually develop? Well, contrary to popular belief, everyone suffering from bulimia doesn't necessarily vomit and purge all the time. So there are two categories here. Those who purge, in the traditional way, we think of purging, and those who don't. So the purging bulimia involves, of course, the regular vomiting or using laxatives and diuretics and enemas to, stay thin. But then we have the non-purging bulimia patients, and they compensate for the calories in other ways. Some of the common ways that a non-purging bulimic tries to make up for eating large amounts of calories include severely restricting food intake. So we have maybe regular periods of intermittent fasting or dieting or excessive exercise beyond the healthy amount. So it's interesting, over the last few years we see the trend for intermittent fasting, right? The keto diet, this diet, that diet. And I'm not saying they're wrong, they have their place. But I like to look a little bit behind the story of the person who advocates them, particularly if they're real obsessive about it. What's their agenda? Do they do that because they have a story? Really be discerning here. So many people with bulimia don't fall neatly in one category. That's really what I would like to share with you here, and might demonstrate behaviors from both. So for example, someone might go for long periods without using laxatives or vomiting, but instead focuses almost obsessively on exercising and burning excessive calories and so on, or have a restrictive diet. While the severity of bulimia can range a lot, depending on the case, of course, the underlying desire and distortion are usually the same: to become thinner and achieve a specific body shape by whatever means necessary. And even if it's harmful to one's health, it doesn't matter, as long as I look thin. Of course, we all go through major life changes, and that is stressful. From moving residence to divorce. Right now, all the youngsters moved out of their parents' home and started to go into college, right? This is the time of the year right now in the US. That can be exhilarating, but also stressful. They're leaving their parents for the first time. Maybe there's homesickness coming up in the next 3 weeks. Puberty. As I said, starting a new career maybe, exhilarating, but maybe you have to move to a new city. All of that can be stressful. But with bulimia, I think, if they have a sense of sort of performance on top of it, if they're ballet dancers, if there are models and gymnasts, that just adds to it. And that really stabilizes, I would say, the bulimia within. So what are the side effects? One of the most dangerous and common side effects of bulimia is the damage done to the digestive system. You constantly heave. What does it do to your stomach, to your colon? Since both binging and purging have negative effects on the things like, for example, the digestive enzyme productions. So what are enzymes? Enzymes are catalysts we need in order to break down the food, the carbs, the lipids, the proteins. We need them to make our food assimilated, right? We need to bring in the food, use our food. When you binge a lot and then purge, you have a loss of fluid, means your electrolyte balance within your body is affected. Vomiting and taking laxatives can both lead to this electrolyte and chemical imbalances, which can wind up causing cascading effects in other systems and organs within your body, like an abnormal heartbeat or depression. So it's like a domino effect. At the same time, high amounts of stress coupled with these nutrient deficiencies can alter your hormone levels and change the neurotransmitter functioning. So maybe your thyroid then is affected. An imbalance in potassium and sodium can alter the balances of key nutrients, as I said, the electrolytes and the fluids. So what could be the complications of bulimia? Irregular heartbeat, for example, dehydration, reduced ability to absorb your food, right? To really get nurtured by it. You maybe eat the food, but nothing goes through the cell wall, so you don't get the nutrients. Bloated stomach. Maybe you develop irritable bowel syndrome, constipation and diarrhea alternating. Higher risk for ulcers. Maybe the gastric wall ruptures. Weight fluctuation, which can affect your endocrine system, like your thyroid. Infertility, irregular periods. Because of this constant stomach acid coming up, there may be yellowing of the teeth or deteriorating of the teeth happening and the gums. Broken blood vessels in the eyes, right? Because of the heaving. Low blood sugar. Often because the esophagus is strained, there can be maybe a swollen or sore throat. The rupture of the esophageal wall can happen, inflamed esophageal pipe. Overall, your immune system goes down and you're more susceptible to infections. Absolutely, depression comes in, anxiety, suicidal thoughts, the whole gamut of mental disorders is part of that too. Some say a decrease in the chemical serotonin in the brain maybe plays a part here as well. But people with bulimia often describe their situation as a constant inner battle. Almost like they have 2 or even 3 opposing voices in their heads, all of which have different desires and agendas. The inner conflict comes from one hand having a strong desire to lose weight and stay thin, look good, while on the other hand having an out of control and compulsive drive to binge eat. So on one side of your shoulder is said binge. On the other side it says, oh my God, now I feel guilty, now I have to purge it out. Since living with bulimia can be very isolating and scary. That in itself just adds to the situation. And the more time goes on, the more this is not addressed and faced and healed, it becomes more difficult. If you're interested in a health consultation either for yourself and or your children, contact me at Medica Nova at health@medicanova.net. Medica Nova is my practice for integrated and educational medicine. We offer a unique blend of natural and cutting-edge therapeutic tools from homeopathy, iridology, sclerology, systemic herbology, advanced biofeedback, and health and wellness coaching, and so much more. Book your appointment today. Let's go deeper and explore our food for thought, or the metaphysical meaning section of this video. As you by now realize, bulimia has a lot to do with your thought pattern. And here I would like to refer to Jacques Martel references, because he describes it very well. He also sort of explains bulimia more in the I person, so you can feel the frequency. And bulimia is a compulsive disease, an uncontrollable need to absorb food in great quantities, a nervous imbalance because I'm in total reaction against life. Bulimia presents the same inner causes as obesity and anorexia, and I thought that is very enlightening here. I eat excessively to satisfy myself completely, or to find a form of love and affection, because food symbolizes life, love, and also emotions. I'm trying to emotionally fill a deep emptiness in myself, a self-hate so great it can be disgust and contempt about oneself even, that I want to fill this void at all costs, preferring to let myself be dominated by food, or food represents life here, rather than open myself up to life. I disavow part of myself or a situation, and I experience sorrow or anger because I feel isolated, separated, or rejected. I totally reject my body, and I refuse to live on this earth even. I no longer want to suffer all these frustrations and anxieties. I'm afraid of losing what I have, and I feel insecure because I may be different from others. I no longer feel able to embrace life. I don't have everything I want, or don't have enough control over my desires and emotions. And I constantly seek the crying need to feel stronger than food and my feelings and emotions. And I therefore prefer to make myself vomit rather than be in good health, because I actually deeply despise myself. I'm suffering an intolerable conflict. I would like people to approach me and allow me to share my emotions and mine, but hey, at the same time, it disturbs me so much that I want to reject them right off, so as not to be affected by my intimacy and to keep control over my emotions. Do you see this enormous inner battle? If that doesn't cause stress, I don't know. The gaze directed at me, either by myself or by others, causes a conflict between my own identity and the image that I project, which often disgusts me. Because, by then they really believe, oh my God, do they, know what's really going on? Do they feel that I have a problem? I tell myself that I'm nothing and that I merge into the mass. I'm submerged, which sometimes actually suits me. However, I also like to take my place, pull my weight, and be different. I generally feel a deep depression, despair, and anguish that I want to soothe. A frustration for which I'm trying to compensate. I have an image of myself that I want to rehabilitate. I want to be so much for it to be perfect. Bulimia is strongly related also to the mother. Why? Because the mother represents the source of life, right? Nurturing. To the maternal side and to the creation. So the question comes up, am I in reaction against my mother? Do I feel that I was controlled and intimidated when I was little, so that by eating like this, I'm trying to escape my mother, neutralize her maybe? maybe more in the metaphysical sense, but you know what I mean, or leave this planet. And do I feel joyful by acting like this? Is it possible that I may have experienced the weaning stage, not so greatly, but when I was a baby, as an abandonment? That is a deep, deep-seated aspect here. Maybe the mother didn't want to feed the baby because she was more occupied with her body image and didn't want to have saggy breasts. Maybe there was some mechanical problem going on, right? The suckling process wasn't happening. Maybe the milk wasn't coming in. Maybe there was lack of milk. But what does the baby then make out of this whole situation? Maybe there was this feeling or sensation of abandonment, not being nurtured. As if I was being torn from my mother. In such a case, I have the impression that I'm going to die of hunger. Caesarean section, incubation, premature birth, and then being taken away from the mother abruptly, maybe for weeks or months to come. That can sort of create this belief system that nurturing is something which doesn't feel normal. Hence, there's the need to eat great amounts of food to fill the void and diminish the stress. I feel lost at the mercy of predators. So what would be the positive affirmation here? I ask you. So as a bulimic person, I must remain open to the frequency of love. Love to oneself, as well as love coming towards you. The necessity of accepting that there's something for me to understand in this depressive state leads me to love. And I learn to love myself and accept myself more as a channel for divine energy. So the emphasis is not about being thin, but you as a person, as a soul. I'm on this earth to accomplish a mission for myself, with my mother and the people I love. You are here not because of your thinness or your obesity, because you have a purpose. Please try to explore that. Why not appreciate the beauty of the universe? I accept my body as it is, my ego and its limits, and food as a gift of life. I accept love for myself and for others, and I discover the joys of being in this world. And he said, that's all. Right? That's enough. That's enough for you to feel present in the here and now and explore your mission and your purpose while you're here on earth. If you want to explore more about yourself, your wellness vision, what motivates you, and how to apply your strengths, qualities in achieving the very best of you, then contact Medica Nova Wellness Coaching at health@medicanova.net for your 3 months coaching program. I am coaching you to be well. Let's move on to the holistic treatment. So what can you do to manage and heal bulimia? First of all, you need professional help. You need to reach out to a counselor, to a therapist, to a nutritionist, to a homeopath. Doctor, I have a question mark. Right? They maybe can refer you to somebody who helps you. But you don't want to be put on antidepressant, anti-anxiety medication. That's not the route to heal bulimia. The compulsive thought patterns that cause bulimia are believed to work like a cycle, since they become habitual and also the new normal for you, for someone who is suffering. However, with the right professional help and the proper training to shift someone's thought patterns and behaviors, the harmful cycle can be broken. I personally believe with cognitive behavioral therapy and homeopathy, deep acting homeopathy, lifestyle changes, and time and love, you can change your bulimia. So stop focusing on this constant dieting, right? Focus more on happiness, on health, rather than the weight in itself. Shift your behavioral thinking. And what happens then? Your cells, the memory in your cells, the behavioral pattern in your cells start to change. If you change your thought patterns, your cells will act in a different way. You will not necessarily feel that food is a threat, or you have to be thin all the time. Start focusing on, I'm enough. I really want to make it in this life. I'm more interested in my path and the soul path and the purpose in my life, rather than constantly what I look like. The weight will fall off by itself. So this perpetuation and this distorted idea about what you are can be changed in a much more, as I said, it's like life-enriching experience. So let's move on to the homeopathic remedies and see what you can do. As I said before, as I mentioned, with the right lifestyle changes, homeopathic remedy, cognitive behavioral therapy, you can absolutely heal bulimia. Homeopathic remedies here are a godsend. And here the homeopath will not only select the indicated remedy for the actual symptom, like the vomiting and the purging, maybe you have the constipation alternating with diarrhea and so on, but mainly for the totality of the individual symptoms, both the psychological as well as the physical symptoms, including your overall personalities and behaviors. That's really where the deep, lasting healing comes in. And we call this in homeopathy the constitutional remedy, a remedy which covers your entire personality. Now, these remedies mainly work on treating its root cause, which in this case with bulimia is mostly psychological in origin. So these remedies are excellent to bring a recovery in mild to moderate cases. But hey, however, if, as I mentioned before, this is a life-threatening disorder, and if you experience complications like severe electrolyte imbalance, major heart or kidney problems, you go to the hospital, you reach out for conventional medical help here. There has to be a balance. But before it gets to this stage, there's so many great solutions you can choose, and I hope this video really inspires you to just explore a little bit here. To book your appointment, because here you need professional help, contact me at Medica Nova at health@medicanova.net or your local homeopath. Most of the remedies I will share with you here, you can have access in your local health food store or online. So this is not very complicated, right? But you can't do this by yourself. I want to stress that as well. Go out and get a therapist here, a counselor as well. First remedy is called lycopodium. Now the keynote here is you have a bloated abdomen with the bulimia. So in homeopathy, we look for keynotes. So if you think your bloated abdomen and your flatulence and excessive fartedness and all of that is really what, gets you the most, then choose lycopodium. If you're overweight, or you have maybe bulimia, which is more related to low self-esteem and low confidence, it's another remedy. Now with lycopodium, you see a lot of bloated abdomen, lots of gas involved. The people maybe have excessive hunger and they eat a lot. The more they eat, the more the urge to eat increases almost. There may be sour belching, maybe heartburn involved. But overall, as a personality, there is the underlying story of lack of self-esteem, lack of confidence. These are the people on the outside present themselves in a big bravado, like I know it all, but inside themselves, they have fear of failure. Let's say they go to a job interview, right? They say, oh, come on, I can do that, I'm a hotshot. Whereas inside themselves, they maybe can't sleep the night before the job interview and worry that they may not be accepted or that people think they are fake and they can see it. See, this inner mental and emotional stress is really what causes the bulimia. I talked about overweight, that you not just see bulimia in thin people. So if there's a personality to plumpness, obesity, and overweight, the remedy Calcarea carbonica, made from calcium, is a good choice here. There may be an increased appetite. They may also complain of exhaustion and weakness because the obesity, the weight gain is there. They usually feel quite weak when walking or when climbing the stairs. They do not want to do any exertion or any other work. They definitely want to go on into the gym. They may also have distended hard abdomen and heartburn in general. The glands on the neck may be affected and swollen, often in children. With this obesity, they often have clammy hands, clammy feet, a bit slow in their personality, very earthy people. Now, with bulimia and coupled with obesity, I want to bring in another remedy, which you maybe have to order online, called saccharum album. It's basically artificial sugar. It's people needing it, have this compulsive eating disorder. Soon after eating, the appetite returns with an empty feeling in the stomach, and they start binging again. They have no sense to stop, right? When they're full. The skin may be also extremely dry. I use this remedy also in autistic children, right? With this compulsive eating sensation. I talked about low confidence. Poor confidence. And we have a remedy called Staphysagria here, which is just a godsend. Here you would need higher potencies, like 200. In your health food store, you see the number 6 or 30 usually, or online, but you can get that in higher potency called 200. Here, of course, you need a professional homeopath to guide you through that. But Staphysagria, people, we call it also the mother-in-law remedy. That gives you an idea where a lot of stress happens within the household, but you keep it inside. Suppressed anger, suppressed rage, feeling of indignation. How dare you say that to me, but you really can't, act upon it. That may be in your work environment, that may be at home. Therefore, we have low or poor self-esteem, low confidence, traits of self-pity. The person absolutely feels like a victim. I'm done hard by. They feel worthless, and they are morbidly sensitive to what other people say to them, to rudeness, to rude language. They feel easily offended, right? And they also feel depressed, and therefore eat large quantities of food. They mostly have a tendency to binge on sweets, like buckets of ice cream, in the evening, following by excessive food and therefore the extreme guilt which comes with it. Oh my God, I've done it again. Staphysagra works it's not like lycopodium where they have this bravado and, being the cocky, I know it all. Staphysagra has a lot of suppressed emotions, and particularly about I'm done hard by, I'm a victim, I'm really angry about it, I feel indignant, they have said that to me, and that was not right, all this unfairness. Brilliant, brilliant, brilliant remedy, which sort of aligns this emotional stagnation within, so you don't have to eat in a compulsive way and hang over the toilet and vomit out your emotions. It's really what this is. If I talked about that excessive purging really affects your digestive system, as well as the binging, of course. But if you purge a lot and lose body fluids, you often become very weak physically, And here we have a remedy called China officinalis, really great remedy, but especially if the person binges at night and then ends up with this extreme weakness. People needing it have a lot of low physical energy. The digestive complaints, of course, are prominent here. There can be a lot of bloatedness, abdomen, gas, diarrhea, but this general physical weakness and tiredness because of the loss of fluids. I talked about depression, anxiety. If there is, let's say, a breakup of a relationship, divorce, financial ruin, right? Or a deep loss, your pet has just died, somebody died, a loved one, then the emotional layer is more on grief, bereavement, and loss. And that can activate or trigger or cause bulimia. The remedy here is Ignatia Mara, wonderful remedy. The person is sad, worried, depressed, has a history of some grief. They may also have sudden mood swings. They can be quite hysterical, right? They can laugh on one side and then be absolutely depressed on the other. It also suits persons who have traits of perfectionism, right? The girls who want to be thin, who look perfect. There's almost an obsession with your body image involved, and who are very overly concerned with their appearance. They're very hard on themselves. So the grief or the depression comes because they just gained another pound in 1 week, and they're not perfect. And I have to say the model industry, is not helping here because, it changes now over the time because we have oversized models as well. But, the emphasis is more on being size 0 rather than size 10 or 12 or 14, what's normal. So they're very hard on themselves when it comes to weight and have a desire to have an ideal body image. Then we have the personalities who are extremely sensitive and even sort of take the grief and the loss a notch deeper. They're really depressed. They want to be alone. They don't want consolation. They stuff everything inside themselves and try to solve the problems by themselves. So they become very depressed. And that will intake, of course, the need to binge. They may also experience weakness and tend to get exhausted easily. Skin may be dry, therefore sexual desire is reduced. Females may be experience irregular periods, absent periods even. And then the last remedy I want to mention here is called Antimodium crudum. And here we have the chronic indigestion related to bulimia. So now we talk about the digestive system. The stomach is affected. They suffer from chronic indigestion and have this distended abdomen. There's a lot of rumbling going on. With it comes heartburn, nausea, and a peculiar finding is when you ask them to stick out their tongue, it's quite coated, often whitish coated. Another complaint is this excessive weakness with it. Actually, we call antimonium crudum personalities the ones who have a gluttony. You just binge and binge and binge and you can't stop, but really it affects their digestive system. So I hope that today's video has inspired you to seek out more natural solutions. I hope I conveyed in this video to you that bulimia has to be healed on the mental emotional level first, not just the vomiting and the binging only. If you have any questions about the suggested treatment protocols, contact my practice Medica Nova at health@medicanova.net. Have a look at my website medicanova.net at the online academy, where I will teach you in an online course and Zoom meetings, certified home study online courses, how to apply homeopathy among you, your friends and family. How about you want to study integrated mental health? You want to learn about health and wellness coaching or quantum healing, or you want to read my book, The Dance of Your Core Healing, Transforming Your Mind and Body in the New World. There's lots to offer here, and as I said before in the beginning of the video, Medica Nova has now expanded its coaching department, and we are offering 3 months smoking cessation protocols. So with that, till next time, much love, and I believe in you. You can kick bulimia. Take care.